My name is Luciano Costa. I'm an associate professor of medicine at University of Alabama at Birmingham and a new comprehensive cancer center. At the EHA this year, we're presenting on the impact of daratumumab in the treatment of multiple myeloma according to cytogenetic risk. As we are well known in the field, daratumumab has impacted the outcomes of both patients with newly diagnosed as well as patients with relapsed refractory myeloma. And that has been demonstrated through several different randomized trials. One point that remains unclear is whether daratumumab impacts the outcome of patients with high-risk cytogenetics in the newly diagnosed settings. And those are those patients with translocation 414, translocation 1416, or deletion 17p. And the reason for such a question comes from the fact that out of the 3 randomized trials in the newly diagnosed setting, that's the MAIA study, the Alcyon study, and the Cassiopeia study, did not show a significant PFS advantage for the daratumumab arm. And the reasons for that could be many, including relatively small sample size for high-risk patients, but also perhaps a smaller effect of daratumumab in those patients. So our way to address that question was through a meta-analysis. Went very systematic to the literature to identify trials in newly diagnosed and in the relapse setting that were a comparison between a backbone myeloma regimen versus the same backbone plus daratumumab, and the had analysis of PFS as one of the endpoints, and they reported results according to cytogenetic risk strata. And not surprisingly, for patients with standard risk cytogenetics, there was a clear advantage of the arm with daratumumab that gave a hazard ratio of 0.45 in the newly diagnosed setting and 0.38 in the relapsed refractory setting. But we also identify a benefit among high-risk patients, and that was seen on the relapsed refractory setting with a hazard ratio of 0.45, and also for the first time identified in the newly diagnosed setting with a hazard ratio of 0.67 that was statistically significant. So in general, when you look across our data, it appears that impact in high risk, as is the case for essentially all myeloma agents, is perhaps of a lesser magnitude than it is in standard risk, but is nevertheless significant. We're talking about a 1/3 reduction in the risk of progression, really indicating that the prior lack of significant results had really to do with short follow-up and with small sample size. Meta-analyses have limitations, and one of them is those studies were different, and the backbone is different. But interestingly, we did not find meaningful heterogeneity when testing for it across the study, really suggesting that the impact of daratumumab is not influenced substantially by what backbone it's being compared with.